ready to start our afternoon, and we are fortunate to have another wonderful physician come in and talk to us, but it's an alternative behavior that now has become mainstream. So our presentation today is by Dr. Usatine. Oh, Richard. Dr. Richard. I was going to say Russell. Sorry. Dr. Russell Usatine. I did say Russell. Dr. Richard Usatine is here to talk about complementary and alternative medicine, how yoga can promote wellness and healing in elders. Dr. Usatine is a full professor at the Department of Family and Community Medicine and is Assistant Director of the Medical Humanities Education at the University of Texas Health Science Center right here in San Antonio. He received his MD from Columbia University and completed his family medicine residency at UCLA Medical Center. He is the co-author of Yoga RX, 8 medical textbooks, and over 100 articles. He co-founded the first yoga and medicine course in a U.S. medical school with Larry Payne in the 1990s. Since 2000, he's been chosen yearly by his peers to be included in the Best Doctors of America. How about that? He has won numerous teaching awards and loves teaching medical students to become passionate doctors. Yes, we need passionate physicians, I agree. Dr. Usatine practices yoga regularly and teaches about the health benefits of yoga to many types of audiences. He is on the advisory council of the International Association of Yoga Therapists. Let's welcome Dr. Usatine.
Good afternoon, everybody. Those were some hard acts to follow. I don't know what is more difficult, the tres leches cake or the singing, but that was really good stuff. And the lunch was delicious. I do speak Spanish, but you do not want to hear me sing, so I promise I will not do any singing for you. I am going to talk about yoga, and I'm going to use some PowerPoint slides to do so. And we'll get started. And actually, our objectives are to define yoga, to describe the evidence regarding the health benefits of yoga and meditation, how to use and prescribe yoga as a health professional. Those are our goals today. So yoga is a entity that has been around for 5,000 plus years. It was founded in India. It comes from the Vedic period within the Indus Valley. Now, I feel like maybe I'm missing some slides. I wonder where they are. Okay, so you know what it is? It looks like the slides that I have here are not the slides that I thought I was going to be showing you. So what I'm going to do is give Mark this, and we'll switch out. I can talk to you about yoga while we're waiting for the switch out, because I actually had some good pictures in here that were extra and better, and I don't want to miss out on those. Let me just start off by finding out how many of you regularly do yoga in the audience. Just raise your hand if you do. Okay. How many of you have done it at least once? Okay, that's great to see. Okay, fantastic. How many of you are social workers? So I know who you are. A lot of social workers. Okay, how many of you are nurses? Well, a lot of nurses, that's great. How many of you are doctors? There have been a few of those. Very good. Well, that gets me a little... am I ready now? This is definitely the right thing. Okay, I knew I was missing something. I was missing the handstand, or the headstand on the Great Wall of China. So I knew that there was something missing in that presentation. So actually, this is my friend Larry, and we were in China together. Actually, we were there to teach yoga in China, and he was doing a yoga headstand on the Great Wall. This is one of my friends, Bill, who both of them now in their 70s still practicing yoga. So that was the reason I chose them for the front. This is the book that I co-authored with my friend Larry. He has an interesting last name, Payne. So for a yoga therapist, it's probably a good name, Larry Payne. And together we wrote this when I was in Los Angeles. I was at UCLA at the time. And Larry, you'll hear a little bit more about Larry. So Larry is also the main author of Yoga for Dummies. And probably more importantly than that, Larry was the co-founder of the International Association of Yoga Therapists. So he really is world-renowned as a yoga therapist. He was the clinician that not only treated me for my back pain when I had a medical problem that wasn't getting better with standard medical therapy, he's also sort of been my friend and colleague for probably about 20 years now. And we talked about the objectives. We have, again, this is about yoga. What does yoga mean? Yoga means yoke or union. It's translated from the Sanskrit, the classical language of India. It's a union of the mind, body, and spirit. Yoga requires you to make an effort to unify your body and your mind, and you do this by concentrating your awareness on the physical body through breathing and postures. And this is Larry doing a headstand literally at the North Pole. I mean, he was at the North Pole. He was on a Soviet icebreaker, got to the North Pole, and was able to do a yoga headstand there. So he's got a chance to do these headstands in multiple parts of our world, which is kind of cool. I don't know that I can do it as well as Larry, so there are no pictures of me doing that. Types of Hatha yoga. So really most of what you see in the US are going to be versions of Hatha yoga. And so you might recognize some of these: Ananda, Ashtanga, Bikram, Iyengar, Kundalini, Sivananda, and Vini yoga, which is actually the type of yoga that Larry and I practice and teach. There are many different asanas or postures or poses. This is an example of a chart showing those. This is one that's not an easy one to do, as you can see. He's only on one foot there. But really, you don't have to be able to do that to do yoga. Here is my friend Bill in his 70s doing yoga. And that stand, the warrior pose, is something that pretty much anyone can do, or many people can do. Here's the big blow up of the headstand on the Great Wall of China. So you don't have to be able to do this to do yoga. This is absolutely not yoga. This is contortionism. This is something, I think, and one of the reasons that some people are afraid of yoga is that they're afraid they have to be able to make their body into a pretzel to do it. You really don't have to do that. You really, if you can raise your hands up in the air, you can, move one foot in front of the other. Actually, quite frankly, there's the pose that's called the corpse. Virtually anyone can do that. Like, you don't even really have to be alive to do that, but it does, I think it's more valuable when you're alive. But you're lying down on your back, so you don't have to do this. You just have to be able to do this. And most of yoga really revolves around the breathing. So it is, again, does not require any particular physical strength or endurance or flexibility. I mean, it's nice to have those, and yoga is something that you can use to work on strength, and flexibility. But the breathing is the key, and the abdominal breathing is something that, and this is a direct quote from Larry, he says that it sends a fax to the brain to relax. And what I'd like to do is, just for a moment, just to have you do the abdominal breathing with me. I want you to put your, let's first put your hands on your belly, and then close your eyes, and then imagine, if you don't feel comfortable closing your eyes, don't worry about it. You can do it with your eyes open. But imagine that you're blowing up a balloon in your abdomen, because that's really what's happening. What you're using is you're using your diaphragm to breathe during yoga breathing. And when your diaphragm contracts and moves downward, it pushes your belly out, and that's the concept of the balloon in the belly. Obviously, there's really no air in your belly. The air is only in your lungs. Okay, let's just do a few breaths together, and I suggest breathe in and out through your nose, unless you have a nose problem, and you can then use your mouth. But most yoga is done through the nose because the nose has the benefit of warming, filtering, and moisturizing air. So let's take a few yoga breaths together. Just take a breath in and out, and the breathing is slow. So slow breath in and a slow breath out. And another thing that people will do when they want to lengthen the breath is they might use a phrase. Om is very commonly used when people want to lengthen the exhale. So let's just do maybe 2 ohms together. So take a deep breath in, and then Om. Again. Om. Okay, feel more relaxed? I hope so. Okay, let's move on. So here's a comic actually from the book Yoga for Dummies. Come on, kids, we've asked you not to do that when your mom's doing her deep breathing exercises. Good for blowing up balloons. Actually, really, if you're using your nose, it wouldn't work that well, right? Okay. What about the yoga postures? So yoga postures are asanas. They're the heart of hatha yoga, stretching that maintains and enhances flexibility. Many poses are a form of isometric strengthening exercise. It means that you're contracting your muscles without really moving the joint. And that's a good thing when you have a joint injury, because isometric exercise, we use it in physical therapy as a rehab method for injured joints. So you can contract the muscle without having to move the joint. Many asanas, these are sort of the English names for them, but they all have names in Sanskrit. And this position is good for reaching inner calm, mental clarity, and things that roll behind the refrigerator. Okay, so there's good evidence that exercise is good for your health. And exercise does many good things. It increases your muscle and bone strength. It increases lean muscle and decreases body fat. It helps control weight. It enhances your psychological well-being. It reduces depression. It reduces symptoms of anxiety and improves your general mood. So I'm always, as a doctor, recommending exercise to all of my patients, no matter what setting it's in. So exercise is wonderful, and there's a lot of good evidence for that. I'm not going to get into all of the studies that prove this, but yoga is exercise. And so, the question is, well, is there evidence that yoga is healthy for you? Well, there is, but just even the evidence that exercise is healthy for you already puts yoga into a place of good health. It involves stretching for flexibility, improved strength, improved balance, things that are really very important for all of us, but important for the elderly, particularly issues of balance, flexibility, and strength. I mean, these are methods for preventing falls. And if a person has good balance, strength, and flexibility, they're much less likely to fall. Herbert Benson is one of the pioneers in the area of mind-body medicine. He defined what's called the relaxation response many years ago. He is a professor at Harvard, and although I have to say I'm still a little puzzled that after all these years he's just still an associate professor. I don't know what happened. But he was the founding president of the Mind-Body Medical Institute. The relaxation response is focused meditation. It's described as, this is how you do it. You sit comfortably with your eyes closed, you pay attention to your breathing. Again, the breathing is the core for all kinds of relaxation, whether you're talking about meditation, transcendental meditation, qigong, yoga, tai chi, it all involves breathing, and breathing is central. So you pay attention to your breathing, you repeat a word or phrase or prayer silently to yourself as you exhale, sort of like we did with the Om. When you notice your mind wandering, and of course particularly at the beginning it will, then you just notice it. You passively bring your attention back to your breathing. It's okay if your mind wanders. You can bring it back to the breathing. One of the things that's described in meditation or in yoga is the idea that the mind is a chattering monkey. It's sort of always, moving around and chattering and, making sounds and taking you all over the place. And so meditation, yoga are meant to calm that chattering monkey. Now, if you were to encounter this bear in the hallway here, you'd be probably quite surprised. But even if you were hiking on a trail and you came across a bear like this, you would have what would be normal to respond with the fight or flight syndrome, which is basically that your sympathetic nervous system will get revved up. It goes on overdrive. It pumps out adrenaline, which is also actually epinephrine as well as norepinephrine, and it raises your heart rate. And so this is the fight or flight syndrome. Now that's normal. You should have that if you encounter a bear. But you shouldn't have that, when you're going through your day. Your whole day should not be fight or flight. And that's one of the things that makes stress so difficult, in our lives is, when we're feeling that when we're driving to work, because the traffic in San Antonio sucks. I thought I was doing a good job when I left LA to come to San Antonio, and now I'm looking at, my wife just said, well, yeah, life isn't so easy anymore. We're dealing with LA traffic here in San Antonio. Well, it seems to be true, but it's probably still not quite as bad. But in any case, you sit in traffic, the I-10 is blocked, you're going to get the fight or flight syndrome. Anything that causes stress is going to increase that sympathetic tone. And the purpose of yoga is to decrease the sympathetic tone, reduce the feelings of stress and anxiety. And so many modern health problems are worsened by stress and anxiety. Most of my practice these days is actually in dermatology. I run the skin clinic at the Robert B. Greene, and I can tell you that most of the patients who have psoriasis, acne, eczema, all of those conditions are made worse by stress. So I know how stress influences, the body, the skin, the mind, the headaches, the abdominal pains. If you can reduce that, you can reduce the sympathetic tone, you can release, you can create that relaxation response, you can improve health. So the relaxation response in this particular article was described as significantly greater reductions in psychological distress, anxiety, perceived stress were found in the experimental group who had learned the relaxation response. So this has been studied. This was one of the studies done at Harvard by Dr. Benson, and the evaluation of mind-body intervention to reduce, that's the name of the article, to reduce psychological distress and perceived stress. And they did this in college students, and whether you're out in the workforce or you're in college, you got things like tests, you got things like evaluations from a boss, you have all kinds of stressors. Anxiety, this was an article and a study done by Dr. Kabat-Zinn, whose name you may recognize. He looked at 22 participants with generalized anxiety disorder or panic disorder, treated them with meditation-based stress reduction and a relaxation program, and significant reductions in anxiety and depression scores were found in 20 of 22 patients. Yoga was one of the interventions along with the meditation. So unfortunately though, yoga is hard to research as a health intervention. And so there was a recent study published in the American Journal of Preventive Medicine just this year, and this review highlights the inadequate reporting and methodologic limitations of current yoga intervention research, which limits study, interpretation, and comparability. So this is a work in progress. Again, I don't think we need the kind of evidence to recommend yoga that we do to put someone on, a medication that might also, hurt their liver or kidneys or cause some major side effects. But we are looking with increased research and some NIH funding in complementary and alternative medicine to try and get more evidence about what yoga does and doesn't do. So let me go through some of the evidence with you, and we'll move forward here. This is yoga for hypertension or high blood pressure. Yoga had a modest but significant effect on systolic blood pressure with a decrease in about 4 points, 4.17 millimeters of mercury, and diastolic blood pressure as well. But now for interventions where they included, because this was a systematic review, they looked at a lot of different studies, this was done in 2013, interventions that had 3 basic elements of yoga practice. If it had postures, meditation, and breathing, the results were better. Blood pressure dropped by as much as 8 points on the top number and 6 points on the bottom number. Well, that's pretty good. I mean, it's not to say yoga should replace antihypertensive medicine or blood pressure medicine, but it certainly can be used in conjunction with it for people who have high blood pressure, which is a large portion of our adult population. How about yoga for post-stroke rehabilitation? This was a systematic review of 9 studies, reported positive results including improvement in cognition, mood, and balance for people who were undergoing stroke rehabilitation. So particularly, I think, pertinent to what we're talking about today, the elderly. Yoga can be prescribed for someone who's had a stroke. Again, if you had a stroke, you don't have to be able to stand on your head on the North Pole, but you can do the breathing, you can work on balance, and you can work on increasing your health. Yoga to improve quality of life of patients with cancer. Persons with breast or prostate cancer were taught to use yoga. Significant improvements were seen in overall quality of life, symptoms of stress, and sleep quality. Well, that's pretty good. I would take all those things. If I can sleep better, if I feel less stress, and if I could say that my quality of life is improved, those are all good reasons to do yoga. Pain in the hands, evaluation of yoga-based regimen for treatment of osteoarthritis of the hands, a very common condition among the elderly. The yoga program was effective in providing relief in hand osteoarthritis. That's a nice result from a rheumatology journal. Carpal tunnel syndrome, even the use of yoga has been studied for that, and it showed significant short-term benefit. It was in the same category with oral steroids, splinting, and ultrasound, and based on a Cochrane review, and that's actually one of the gold standards of reviewing medical journals, medical articles, is what's called, we call the Cochrane review, done by a group of mostly physicians looking for things that are significantly, have significant evidence to support them. This was published in JAMA. Yoga to prevent seizures. Actually, there was a more than 50% reduction in seizure frequency and duration compared with the control groups. This was again from the Cochrane database, so a reliable group of people reviewing these studies. Now, I'm not going to tell you if you have a patient who has seizures, stop their anti-seizure medicine and just put them on yoga. I don't think that would be responsible. But on the other hand, someone who has seizures who's on medicine may, according to this, benefit from a reduction in the seizure frequency and duration with the use of yoga. Yoga for improving sleep quality and quality of life for older adults. There's a lot on this slide, and I don't expect you to read it, but the bottom line is that the people who were in the intervention group, what they found was they had overall improvement in overall sleep quality, sleep efficiency, all these different measures, sleep latency, duration, self-assessed sleep quality, fatigue, general well-being, depression, anxiety, all of these things, stress, tension, anger, vitality, function, physical, emotional, and social roles, all these things were rated as significant improvement in those people who practice yoga. Sounds pretty good. Yoga and sleep. Yoga was shown to be safe and improve sleep and quality of life in a group of older adults with insomnia. Now, outcomes depend on practice compliance. Just like anything, people, when they're given medicine, the medicine's not going to work if they don't take it. Yoga is not going to work if you don't do it. So it does require adherence or compliance for these things to work. I will tell you a little eczema story. This is purely anecdotal, but I think it's relevant to what we're talking about. This was a patient of mine back at UCLA, and she had really bad eczema. Her hands were always red and scaling. She had it on around her mouth as well. I gave her all, the medicines that I've been trained to give for eczema, and she wasn't getting better. In fact, she just eventually kind of gave up and stopped coming to my office. Well, when I was writing Yoga RX with Larry, I went over to one of his yoga classes one evening, and who do I run into? I run into my patient, and her hands and her face are completely clear, and I ask her, well, I say hello, of course, we chat a little bit, and in fact, I don't even have to ask her. She just spontaneously told me, she said, Dr. Usatine, since I started doing yoga, my skin is cleared up. And I'm not using any medicines, and I'm feeling really good. So I think that, yoga is a good example of how yoga can help for an individual. This is not a randomized controlled trial, but it does show that individuals can improve with yoga. If you look at the evidence, and we're not going to go through, I mean, there used to be a small number of studies, but we're now looking at well over 1,000 studies now on yoga. If you look at PubMed, the National Library of Medicine, over 1,000 studies, and yoga may help to heal or treat all of these things that are on this list here. In fact, many of these things we have chapters in our Yoga RX book. So yoga and meditation to stay healthy. So exercising and relaxation can reduce the feelings of stress and keep the body and the mind healthy. Back pain, that is actually one of the areas where yoga is very helpful. That was really one of the things that got me to use yoga again. I had studied yoga in college, but for years I was busy swimming and cycling and playing tennis and really not paying much attention to yoga. But I had a back injury from a car accident, and with a year of sort of traditional medical care, I was not getting better. Then a physiatrist, a rehabilitation doctor, referred me to Larry because he's a yoga therapist. And really what Larry taught me in a few weeks made my back better than anything that was done, including injections and medicines from traditional medicine. Again, I'm not someone who says we should drop traditional medicine. I think there's a role for both. That's why it's complementary. But if you look at what yoga for back pain is, it's very similar to physical therapy in that, Williams flexion exercises, which are basically a type of exercise where the back is flexed, and McKenzie extension exercises where there's an extension of the back, are both things that are used within yoga. In fact, the McKenzie extension exercise is really just Dr. McKenzie adding his name to what is really called the cobra in yoga, which has been around for 5,000 years. Dr. McKenzie was not around for 5,000 years, but he did describe the use of it in physical therapy. So you take this physical therapy approach, you add the breathing and the relaxation, and I truly believe that it is more effective than just pure physical therapy. And it was for me, because actually I'd gone through the physical therapy in addition to the facet injections. In fact, Larry started doing yoga himself when he was back in his 30s. He was a busy and successful advertising executive and was suffering from chronic back pain. And he was introduced to yoga, started working with it for his back, and ended up leaving advertising and working with yoga full time. This is one of the examples of Larry's yoga programs. He's really, as he's now reached 70 himself, he's really focusing his yoga program on people. He calls it the prime of life yoga, which is yoga for people like you and I. I see we're mostly in this audience, everyone mostly above 20. So yes, but yoga, you don't have to be a teenager or a college student to do yoga, and anyone can do it. It can be user friendly. This is the website for the International Association of Yoga Therapists, and yoga therapy is taking yoga and using it actually like you would use physical therapy as a way to help people heal from injuries and from medical problems, as opposed to just yoga for protecting health, but yoga for actually healing from health problems. So what do I do with yoga in my practice? I teach yoga breathing for smoking cessation. It's a really great, again, way to relax. If you can, instead of going for a cigarette, go, do the abdominal breathing. That's an alternative that you can give people when they're trying to quit smoking. If I'm doing a medical procedure and someone is anxious, I'll teach them how to do the yoga breathing. I use it for anxiety. Actually, I don't have it on this list, but I frequently teach people with insomnia how to use yoga for their insomnia. And then I will also be willing to refer to a yoga therapist. So yoga as forms of medical treatment, do yoga and yoga therapy meet the standards for being safe and effective? So really anything that we do sort of medically or in health treatment should be safe and it should be effective. Well, it's clearly, well, I shouldn't say clearly. It should mostly be safe. It certainly, we know it doesn't have, and people don't get allergic reactions to it. They don't damage their liver or kidneys from it. They don't end up in the hospital, with some, bleeding, from such and such a place because they gastrointestinal bleeding, other things that can happen with some things as simple as ibuprofen. So it is safe in that way, but it's not completely safe in that you can have a musculoskeletal injury from yoga. So what's really important, and particularly I think as we talk to people who are older, is that they listen to their own body and that they're not pushed by teachers that don't understand maybe limitations of age or limitations of different body types. I have tight hamstrings. I work on them, but that is something that my dad gave me, and they're not going to ever be the loosey-goosey hamstrings that allow people, to bend like pretzels. I can't do that. So I have a limitation. I'm not going to do every pose that every other person in a particular yoga class might be able to do. But you have to avoid postures that do not work due to your lack of strength, balance, or flexibility. Not everyone should be standing on their head who does yoga. But you can start or continue into late in life. Yoga may not be for everyone, but it can be done by most anyone. I'm going to give you a nice example of someone in San Antonio who's 94 years old and is a yoga teacher. This was an article from San Antonio Express News. This is Esther Wexler. Some of you may already know Esther or have actually studied with her. And this is from the article itself. These were items that I took from the article. But it says that Esther Wexler continues to practice yoga daily, teaches several classes a week. This was just within the last year this article was printed. Her balance isn't what it used to be, and she uses a cane when she walks to prevent falls. Most standing yoga poses are difficult for her now. She actually also has rheumatoid arthritis, so there are other reasons why there are limitations. But when she can, she demonstrates poses for her for her students during class. They're probably about the age of her children or grandchildren or great-grandchildren. When she can't, she sometimes adjusts their postures while delivering instructions in her low, gentle voice. So, 94, a person can still do yoga. Graceful aging with yoga, you do what your body will let you do. These are direct quotes from Esther. You have to keep moving no matter if it hurts. It hurts worse if you don't move. So you get in the habit of responding to the aging process with a more positive attitude. So movement is good. Yoga is just one method. I'm not here to say it's the only method. It's effective. We reviewed some studies showing effectiveness for certain conditions. People only continue yoga when they find that it works for them. So I call that a built-in effectiveness meter. If it doesn't work, if it's hurting you, you stop it. People often continue medications when they see or feel no benefit and are subject to real side effects. Yoga can be low cost or free if performed at your home. You don't actually have to do yoga in a class. In fact, really, I do my yoga at home on a yoga mat. Often, actually, I play something that Larry has created for me so that I have his voice and music, and that helps me. But you can find a million, yoga tapes, yoga DVDs, yoga, MP4s or MP3s, whatever. So there's plenty of stuff out there if you want to do yoga at home or you want to recommend it for people to do at home. But yoga to me is really most important when it's practiced as part of an overall healthy lifestyle. So yoga should go along with a good diet, with aerobic exercise, with no smoking, with wearing seatbelts. Because truly, if we're talking about health, we're not talking about one thing. Health is many-faceted and should be practiced in many different ways. How would you get started? How can other people get started? We mentioned that there are books. There's Yoga for Dummies. You're welcome to look at Yoga RX if that interests you. There are hundreds, thousands of yoga books these days. There are many videos, there are many websites, there are classes all over the world. There's probably no town in the US now where you cannot find a yoga class. That wasn't true 20, 30 years ago, but it's everywhere. So in conclusion, yoga can be valuable to you, to your patients. We can write prescriptions for healthy lifestyles, not just medications. We can write and say, I recommend that this diet, this exercise, this yoga, this movement, and here's an example of a little prescription I wrote to Joe Stress, yoga, at least 10 minutes each day. Well, I don't really know that that's the right amount of time, but I was just showing how you can use a prescription pad or a note to recommend a good lifestyle. And I put down here, refill for life. And thank you for your attention.